I really believe that every family deserves to bring home fresh, healthy food. And what's exciting about being a part of this work is that we've proven that these programs do, in fact, help families access and eat more fresh, healthy food.
The main goals of the GusNIP NTAE Center are to really help the grantees in achieving their goals, and their goals are to increase purchase and consumption of fruits and vegetables, decrease food insecurity, improve health, and then lastly, for produce prescription, also decrease healthcare utilization costs and use. So the Gretchen Swanson Center for Nutrition plays the role of, ultimately we are the lead for the GusNIP NTAE Center, and we're also the lead for reporting and evaluation. There are a lot of partners that make up the coalition that is known as the Nutrition Incentive Hub. So on the reporting and evaluation side, we have the Gretchen Swanson Center for Nutrition, then we have University of California, San Francisco, we have DMAC, who helps on all of our statistical analyses, and then we have just a plethora of consultants who are program advisors and work on various research aspects of the hub. And then on the technical assistance side, we have Fair Food Network, and then a whole bunch of wonderful experts that are ready to help.
The Nutrition Incentive Hub is a coalition of partners that was created by the NTAE Center. Fair Food Network focuses on leading the technical assistance, and we have a variety of partners that we work closely with. This includes the National Grocers Association Foundation, the Food Trust, and the Michigan Farmers Market Association, among other industry experts. Before the NTAE Center was developed, there was technical assistance that was provided to the field, but it was much more ad hoc. And so what the creation of the center has allowed us to do is reach more grantees in more places and help more practitioners to learn about the GusNIP opportunity and become part of this broader field. Through the work of the hub, we're really trying to help practitioners from start to finish. So we're helping them with the application process, and then once they are implementing their programs, we're doing things like offering them tools and templates. We've got communities of practice, we've got peer learning, webinars, and lots of events that we provide to help them implement the best, most effective program. I think the Nutrition Incentive Hub has done a good job of bringing together a set of diverse partners that really are able to address the issues and challenges that practitioners run into as they're implementing their programs.
The GusNIP program has been hugely beneficial to the communities that we serve in two ways. One, from the participant perspective, where we have direct feedback from people who use our program that they wouldn't be able to afford the type of produce that they want and desire without this program, those local foods. And secondly, the GusNIP program has really helped our organization go from being a really community-based organization to expanding our scope to be statewide, which has been our goal all along, and we couldn't do it without the GusNIP funding. The Nutrition Incentive Hub has been instrumental in helping us implement our GusNIP project from the day we had our award through today, where we're still going through technical assistance all the time with the Nutrition Incentive Hub. Anywhere from how to do effective onboarding of a Farm Direct site to how to think about sustainability and future funding.
The Nutrition Incentive Hub has been extremely helpful to us. Most recently, we applied for a GusNIP 2023 application, and they guided us through the entire process, providing templates and guidance documents to ensure that we had a very strong application.
Without the Nutrition Incentive Hub, many small community-based nonprofits would probably not be able to access GusNIP funding. And that would really negatively impact people who are using federal nutrition benefits. It would reduce abilities for frontline organizations to be able to support their communities, and it would really block a lot of small nonprofits and folks in poverty from being able to access these double up programs.
I really feel like the NTAE Center has helped both the nutrition incentive and produce prescription fields grow in that we are providing evidence, so we are able to show how these programs work, how successful they are, to also show the need for continued funding, both for produce prescription as well as nutrition incentive. We saw in years 2 and 3 an increase in fruit and vegetable consumption and a decrease in food insecurity. That shows these programs work. It's so important to be able to show that to, make sure these programs continue into the future.
We've come so far, and there's so much more that these programs can do. We know that they work, and we also know that there's many more families and many more places around the country that could benefit from nutrition incentives. At the Hub, we're right here and we're ready to help.